We'll grab our foam roller, beginning with unilateral rolling of our calves. Let's start with your dominant leg. Fingertips are facing the buttocks or to the side. Soft bend in the elbows. You should be rolling from the top of the calf, right near the knee, all the way down to the Achilles, keeping the leg parallel and the foot dorsiflexed. You can play around with external rotation of the leg from the top of the hip socket. Keeping the foot dorsiflexed is important with flat back posture to combat the plantar flexion in the ankles. Now let's start to focus on our breathing. Thinking about how we're breathing is important in learning how to contract the deepest layer of your core, the transverse abdominis. So before we begin, make sure your tailbone is reaching back towards your hands behind you, so you have a little lumbar extension, and you're bracing your abs like you're going to be punched in the gut. Now go ahead and switch sides. And once you're set up, inhale through your nose. Pull your belly button in towards your spine like you're putting on a tight pair of jeans. And lift up internally on those muscles that stop your stream of pee. Hold that lift with your belly pulled in towards your spine and sustain it as you exhale the air out of the mouth like you're fogging up a mirror. You should feel a low belly burn. Inhaling through your nose, pull the navel in towards your spine. Lift up internally, so this isn't a movement that anybody would visually see. This is an internal lift of the muscles that stop your stream of pee. Hold that lift and fog a mirror with your exhale, sustaining the lift of the pelvic floor. One more time, inhale through the nose. Draw the belly button in towards the spine. Brace those abs, keeping the brace. Exhale the air out. We'll set the foam roller to the side and grab our anti-burst ball. Come to lie on your back, supine, and slide the anti-burst ball under your sacrum. Find some lumbar extension, taking your pointer fingers and bringing them to the bony protrusions of your hips, guiding them down so that your low back is arching. Keep your abs braced here to support the low back in this position. And now guide those bony protrusions back to a neutral pelvis. Moving back and forth from extension to neutral pelvis will feel great for releasing the low back before we begin our lower ab series. Exhale as you slip into extension, moving down into that low back arch, and inhale as you bring it back up to neutral. Exhale down, inhale up, and exhale down, inhale lift. Small movement, just an isolation of the pelvis. Using the breath, using those contractions of the transverse abdominis, the navel to spine, the lift of the muscles that stop your stream of pee. Let's take our hands down to the ground, pressing our arm extensors, the triceps, the wrists, the palms, into the ground to stabilize the torso. Think about your sternum melting in towards your spine and your back ribs pressing heavy into the floor. We're going to float up our non-dominant leg. So whichever leg is the weakest, whichever side of your abdominals is the weakest, it's usually your non-dominant side. From here, we're going to take tabletop lower and lifts. On a count of 3, we'll lower, and on a count of 3, we'll lift. Inhaling to lower with a dorsiflexed foot, 2, 3. Exhaling to lift, 2, 3. Inhale, lower, 2, 3. Brace those abs, reaching the tailbone away. Exhale, lift up, 2, 3. Inhale, lower, 2, 3. Brace the abs. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Brace and lift, 2, 3. Make sure the rib cage isn't pushing out, that you're keeping those back ribs pressed heavy into the floor. The sternum is melting in towards the spine. The shoulders are melting down the back, not elevating up near the ears. Go ahead and switch sides after your next one. Setting up with a nice dorsiflexed foot, working for pelvic stability, so watching out for rocking in the pelvis here. Lowering on that 3 count, pulling the abs in, lifting up on the muscles that stop your stream of pee to lift the leg back up. We inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, and make sure when you bring the leg up, the knee doesn't track close to the chest, that it's tracking right over the hip. This will really challenge the lower abdominals. The more you bring the knee in towards the chest, the more of a modification you're doing, and you're going to grip and use more quad and hip flexors. We want to train the low abs here. We'll get into quad and hip flexor work in a bit. After your last one here, place the foot down and pick the pelvis up, sliding the ball out. We'll put it between the inner thighs now, opening our arms out to a T, imprinting the backs of the arms, the knuckles, the shoulders, and make sure that the wrists are not above the shoulders, that they're slightly below. Imprint the back ribs, close the rib cage, sternum melting in towards the spine, reach the tailbone away from you. Find that lumbar extension and float your legs up to tabletop. We're going to take some supine twisting for the transverse abdominis, taking the knees to the right, head to the left. At the bottom, we pulse in on the ball. 2, 3, 4. Pause, inhale, brace your abs, and bring the legs back up to the starting position. Make sure the tailbone's reaching away, creating lumbar extension, and other direction, twisting. Exhale, pulse in on the ball. 2, 3, 4. Inhale, prepare. Brace the abs, and exhale, lift back to center. Inhale to lower the legs. Exhale to squeeze in on the ball. 2, 3, 4. Inhale, prepare. Exhale, come back up to tabletop, remembering the knees are tracking over the hips. They're not pulling in towards the chest. Tailbone reaches away, sternum melts in. Taking it to the other side, inhale down. Squeeze, 2, 3, 4. Inhale, prepare. And exhale, lift back up to center. Let's do 2 more on each side. Taking that twist, squeezing in, 2, 3, 4. Inhale, prepare. Belly button to spine. Lift up on those muscles that stop your stream of pee back to center. Inhale to the other side. Exhale, squeeze. 2, 3, 4. Inhale, prepare. Brace those abs. Exhale, bring it back to center. Feet are dorsiflexed. Tailbone reaches away from you. Inhale, lower. Exhale, squeeze. 2, 3, 4. Inhale, prepare. Exhale, back to center. And last time. Inhale, lower. Exhale, squeeze. 2, 3, 4. Inhale, prepare, brace, and exhale, lift back to center. We will come off of the ball, setting it to the side. We're going to we'll take the ball and we're going to place it behind the shoulder blades. We're going to work on our rectus abdominis, and we'll take the hands behind the head, tucking the chin to create a double chin to engage the neck flexors. Feet are on the ground, knees pointing up to the ceiling. Slow 3 count up and 3 count down, pressing the back ribs into the ball as you go up and down, reaching the tailbone away to keep some lumbar extension. Exhale, lift up. 2, 3. Inhale, lower. 2, 3. Exhale, lift. 2, 3. Inhale, lower. 2, 3. Exhale to lift. 2, 3. Inhale, lower. 2, 3. Keep that tempo going. I want you to think about your sternum, reaching for your spine, your back ribs pressing into the ball both when you go up and down, tailbone reaching away. We're working the outer upper layer of the core here. 1 more. Great work. Let's go ahead and grab our foam roller, and we're going to tie the lightest Theraband around it in a knot coming against the wall. We'll lie supine with both feet anchoring the roller against the wall. You're going to keep one hand by your side, and we're going to do angels, snow angels on the floor, imprinting the backs of the arms as we slide up all the way with the arms overhead, trying to keep our back ribs, our shoulder blades imprinting into the floor as we do this, engaging the abdominals, and then sliding back to the hips. Going at a nice slow tempo as to not pull the front of the shoulder, lifting up and lowering down. Make sure you're breathing here. Inhale to lower. Exhale to lift. The resistance is on the way up. Once we start going down, the resistance gets easier. Don't think so much about the weight of the band. Think rather about how heavy you can imprint your body into the floor. We're trying to create more back awareness to combat the kyphosis. Let's go ahead and sit up, switch the roller, come back down. We'll put our feet against it and begin on the other side. Imprinting the body, focusing on making sure that you're imprinting evenly on both sides of the body. Since you're working one side, the other side shouldn't be lifting or hiking up. Be aware. Close those front ribs, reach the tailbone away, still keeping some lumbar extension. Your feet are dorsiflexed, again, great to combat the plantar flexion. And you're breathing, you hear your exhales like you're fogging a mirror. Or if you're bracing, you can make a sound like that, as if you were being punched in the gut. All of which will contract that transverse abdominis. Let's move into a prone position now. Taking the roller, you can take the band off of it. Lying prone, we'll have the roller under our forearms, slightly above them. And once you're set up, the palms should be facing in towards one another. Bony protrusions of the hips anchored into the floor. Abs pulled in and up. We're going to lift into upper back extension, exhaling to lift. Inhale at the top, pull the abs in, brace them. Staying here, exhale the air out. Shoulders are plugged down the back. Inhale again, brace the abs, and exhale, lower back down with control. Inhale at the bottom. Brace the abs, exhale, lift up. Hold it here. Inhale, brace the abs, and exhale, lower down. 2 more like that. Inhale. Lift the pelvic floor muscles, come up. Inhale. Exhale, stay. Inhale. Exhale, lower. 1 more time. Inhale. Brace the abs, exhale, lift. Inhale at the top, exhale. Inhale, prepare. And exhale, lower down. Grab that band, go ahead and put it back on the foam roller in the same position on one side. We're going to set up on all fours for pointer dog. Whatever arm is weakest, let's work that arm first. Opposite arm and leg extend. The leg can stay down, toes are on the ground, or it can lift up for more of a challenge for the abs. We're going to lift the opposite arm as leg up, 2, 3, and lower, 2, 3. Keep the shoulder plug down, lift, 2, 3, close those ribs, and lower, 2, 3. Take it up, 2, 3, and lower, 2, 3. Lift, 2, 3, and lower, 2, 3. 3 more, take it up, 2, 3, and lower, 2, 3. Exhaling the air out. Inhaling to lower. Trying to not wobble on the roller, staying nice and firm through your abdomen. And lower. 2, 3. Go ahead and switch sides. Setting up. Knees tracking right under the hip. Wrist right under the shoulder. Soft bend in your supporting elbow. Palm facing in towards the face. Dorsiflex that back leg, the foot, so the toes are pointing, reaching towards you. And go ahead, begin with the arm work. We're keeping that leg in an isometric hold. The arm is just moving up, overhead, engaging the back of the shoulder. And lower, 2, 3. Go ahead and lift, 2, 3, and lower, 2, 3. Keeping that tempo. 4 more. Focusing on bracing the abdominal wall here, keeping the shoulders plugged down the back, keeping the ribs closed. You can almost think about a hand hovering above the shoulder blades and trying to puff the shoulder blades up to reach that hand. We want the serratus anterior, the shoulder anchor, to be active. And 2 more. Checking in with your breath. Let's set up for our next exercise. We'll need the anti-burst ball. And we have our lightest band tied around. Go ahead and switch the position of the roller so that we can work your non-dominant side first. We're going to do some lateral flexion, side bending with the ball between the knees, and then adding the bottom arm as a lever with an isometric hold. So let's begin taking your side bend over, inhale, add the bottom arm, exhale, hold it here. Inhale 1, breathe, exhale 1, inhale 2, exhale 2, and come right back up to center. A big thing that happens here, keep going, is the ribs pushing out, especially once you add the resistance of the bottom arm that is sweeping from your hip all the way out to that T. Palms are facing one another, shoulders need to stay down the back, and you need to keep your ribs closed. On your next one, remember we're holding for 2 full inhales and exhales before coming back to our starting position. The ball is there just so you can feel the inner line of the body squeezing in with the adductors, pulling in and up with the pelvic floor muscles. You can think about your tailbone reaching down and back, creating that lumbar extension we worked on during our abdominal work. When you're holding that isometric hold with the resistance of the band, make sure the shoulder is down the back and the ribs are closed. Let's go ahead and switch sides. Turning the roller around, setting up on your knees. The toes are tucked. And since this side is your dominant side, if it feels relatively easy to hold the position, you can challenge yourself when you're in lateral flexion to lift the toes of the opposite leg. So if you're bending to the right, you'll lift your left toes. And if you're bending to your left, you'll lift your right toes. So once you go over, you inhale, you add the bottom arm, hold it here. Inhale 1, exhale 1, the opposite toes are lifted to challenge the obliques even more. Inhale 2, exhale 2, and you bring your body back upright. Last one, taking it over, holding. Inhale 1, breathe, exhale 1, inhale 2, exhale 2, bringing it back upright, making your way off of the roller, pulling the band off, and untying the knot. Great work. Grab your anti-burst ball. We're going to bring it under the sacrum, lying supine for quadricep work. Anchor your arm extensors by your side, pressing the triceps, wrists, and palms heavy into the floor. Dorsiflex one foot, sliding it out long on the floor. Guide your tailbone away from you, creating lumbar extension. Reach the sternum in and the back ribs, sternum in towards the spine, and the back ribs press heavy into the floor. From here, we're going to lift the extended leg up, 2, 3, and we'll lower on our inhale, 2, 3. Brace the abs to exhale, lift, 2, 3. Inhale, lower, 2, 3. It's very important that you're bracing your abs to keep the low back safe, and that you're keeping the foot dorsiflexed so we can combat that plantar flexion in the ankles. So it's not about height here. I have your pelvis elevated so that the hamstrings aren't straining and doing the work, that you can find the muscles in front of the thigh and activate them. So make sure you're squeezing the front of the thigh and you're not trying to kick the leg up to 90. It's not about height here. Good. Bend that knee in. Hold it in. Squeezing the front of the opposite thigh. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3, and switch sides. Setting up, dorsiflex the foot. Press the palms heavy. Reach the tailbone away. Sternum reaches for the back ribs press heavy into the floor. And we lift as we brace our abs up, 2, 3, and lower, 2, 3. Brace those abs, and lower, 2, 3. Not going for height, simply going at a nice slow tempo, engaging the front of the thigh to build strength. Keep thinking about your breath and how you can engage those lower abdominals to support the movement and keep the lumbar safe. The deeper these TVA contractions are, your transverse abdominis, the safer your low back will be. Last one, lift up, 2, 3, and lower, 2, 3. Go ahead and hug that knee in, extending the opposite leg out, holding here for a psoas stretch. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Bringing both feet to the ground, lifting the pelvis up. We're going to grab our lightest loop band and we'll bring it around the arch of the feet. Lying supine, elevating the pelvis. Again, reaching the tailbone away, finding lumbar extension, reaching the sternum in towards the spine and the back ribs. Press heavy into the floor. Widen your collarbone. We're going to march here, dorsiflexing the foot, staying on your non-dominant side first, unilateral marching. Lift up, 2, 3, and lower, 2, 3. Exhale to lift, 2, 3. Inhale to lower, 2, 3. Taking your time. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. 4 more, and lift, 2, 3. And lower, 2, 3. Lift, 2, 3. And lower, 2, 3. Keep going. Close those ribs. Reach the tailbone away from you. Dorsiflex the foot. Brace your abdominal wall. Relax the chest. Tuck your chin to lengthen the back of the neck and engage the neck flexors. And finish up your last one. We'll go to the other side. Setting up with that dorsiflexed foot, being mindful of how the pelvic position is when you lift the leg up. I see a lot of people tuck their pelvis as the leg lifts up. That puts pressure on the low back. We're trying to extend the low back here. Reach the tailbone towards the bottom of the mat, away from your face, allowing that extension. And now moving on the breath, keeping the foot dorsiflexed the entire exercise. Are your arms still active? Press into the backs of the arms, the palms, the wrists. And when you do so, does your rib cage press out? Keep it soft, puddling the heart in. From here, we'll kick the band off. We'll extend one leg out long, internally rotating the leg in the hip socket. When you lift up, make sure you keep the foot dorsiflexed. Again, this is not about height, it's about building strength in the quadriceps. So lifting up on that 3 count, 2, 3, and inhale, lowering, 2, 3. Really dorsiflex the foot. So that inversion of the leg in the hip socket is going to allow you to access the psoas and the quadricep as you lift up. You're not going for height, you're going for contraction and strength work in your quadriceps and your hip flexors. And keep going. Lifting, 2, 3, and lowering, 2, 3. Nice steady tempo. Here are your exhales. Sternum reaching in towards the back body. And let's slide the opposite leg out, switching sides after your next one. Setting up, legs out, dorsiflexed foot, inversion from the hip socket, turning the leg in, pigeon-toed, and then begin your lifts, lifting up for 3 and down for 3. And every time you lift that leg, make sure your abs are braced. If someone punched you in the gut, wouldn't hurt because you're tight. Hear that breath, huh, every time you lift that leg. So it can be like you're fogging a mirror, it can be a stream of breath, or it can be a quick huh, but you hold the contraction regardless. So you sustain the lift of the pelvic floor. I prefer the, like you're blowing air out, fogging a mirror, because I can continue to hear it. When I tend to hold my breath. But I do feel those muscles contract when I make that sound. So if that is what works for you, please do that so that you're firing the transverse abdominis to support the low back. Reach the tailbone away from you here. Be cognizant of your feet. Is the inner and outer edge of the foot flexing? So the baby toes should be flexing as much as the big toe. Shoulders should be on the mat, down the back, not elevating up near the ears. And finish up your last one. I want you to take your pointer fingers to the bony protrusions of the hips and guide them down to extension and back to neutral pelvis. 4 more of those. Exhale, down to extension. Inhale, neutral pelvis. Exhale, extension. Inhale, neutral pelvis. 2 more. 2 and 1. Lifting the hips high in the air, sliding the ball out, setting it to the side. Coming up to sit. Good work.